Good afternoon and welcome to Bariatric Friday. My name is Kemal Erkan. I'm the chairman of American Surgery Center. I'm here with Dr. Isaias Irgau, our president for Christiana Institute of Advanced Surgery and also for American Surgery Center. Dr. Irgau, how are you doing?
I'm doing great. The question is, how are you doing after that wonderful interview with Lieutenant Governor Bethany Hall-Long?
Thank you. So I think it was a great conversation. The reason these are important for us, person who's in charge of the state is going to be also dealing with healthcare-related issues. And our Bariatric Friday topic is morbid obesity, and the state of Delaware is not doing so great. Most of United States is not, but even for Delaware, it's more important. So having the person who understands the healthcare, having the right background, it makes the conversation more engaging because the healthcare is our job. So I'm glad that she's on the same page with many of the issues that we discussed, but it was a very fun event. So,
well, I tell you what was exciting watching this interview, Kemal, and what's clear for us, particularly physicians, surgeons who work in Delaware, is you are bringing front and center the issue of healthcare to the various politicians who are going to be responsible for many decisions that affect us, our community in the future. So these are very important conversation. And, as they take office, if they come out fresh from, questions and interviews with you like this, then healthcare is going to stay, very prominent in their consideration. So it is very important for us. I mean, I cannot recall any other situation where somebody as connected as you are to healthcare was really questioning the politicians on this issue. So this is very, very important.
Absolutely. Dr. Gab, today we're going to discuss smoking and alcohol and related to bariatric surgery process and pre and post-surgical. And this issue, as you and we know very well, going through the daily case conferences, one of the checkpoints we have is especially around smoking, as well as alcohol use. So since our patients are going through a lot of different screenings, luckily we don't have a lot of smokers. So, but we still have enough to kind of make this issue big because we want to make sure that they get the best outcome. So overall, if you can kind of give us the background on this issue, why this is important and what patients should be expecting from us.
Yeah, I want to start with alcohol this time because maybe we have started with smoking other times and we may not have devoted as much time to alcohol. So essentially, this is a very important question that comes up all the time. Doctor, can I have some alcohol after I've had bariatric surgery? And the simple answer to that is yes, you can, but there is a big but there, right? And we have to understand all those intricacies and make sure patients also understand them. So one of the things that are very, very clear is that after bariatric surgery, the effect of alcohol is a lot more significant on the body than it is before bariatric surgery, right? And that is because the changes that we make with bariatric surgery allow for things that we ingest to be absorbed much more quickly and readily, particularly after bariatric surgery. So, people have actually measured how long it takes for alcohol to achieve peak levels after bariatric surgery. And for the gastric sleeve, within 9 minutes. For the gastric bypass, it could be as little as 5 minutes, and you've got peak alcohol levels. A patient, somebody who drinks a glass of wine, could have, alcohol levels that are higher than the driving limits, with just one glass of alcohol after gastric bypass. So there are drastic effects of alcohol on the body, and these are important for people to understand, right? So when they drink alcohol, the effect of alcohol will be a lot stronger and a lot quicker, but also the alcohol doesn't leave the bloodstream until much later compared to a person who hasn't had bariatric surgery. So the effect is going to be there. So these are important things for people to know and understand. And then there are, yeah, go ahead.
I'm sorry, go ahead.
So, and then obviously there are the other issues that have to be considered that are very much related to the issue of being a bariatric patient. You obviously want to minimize the intake of excess calories that are not going to help you to lose weight, but also they may really sabotage your attempts at losing weight by getting you more calories. So people who drink alcohol, they have to understand they are taking excess calories. Alcohol itself is something that stimulates appetite very often. And so people may be tended to consume more food after they drink alcohol, or people may not be as clear-minded to understand and follow their focus attitude, after they drink alcohol. So all these issues have an impact. But how about dehydration? We talk about dehydration being a major issue, right? For bariatric patients, we emphasize to them that they have to drink a lot of water. And the reason we say that is their ability to catch up with thirst is limited. If they're thirsty, they cannot just grab a bottle of water and then drink continuously because their stomach is so small, right? So if they drink alcohol on top of that, as we know, alcohol dehydrates people, right? So that is going to contribute significantly to it as well. So all these effects of alcohol impacting your ability to think, alcohol being much more intoxicating at smaller amounts and for longer period of time after person has had bariatric surgery. All these are important issues.
So I think we really need to understand this is not about just. I always make this point in almost every other episode. It's not about just patients who are going through the surgery, but patients who are not going through the surgery, or people like us who are not going to go through, hopefully, any of the process, because we are trying to maintain what we have by limiting alcohol consumption. And that's kind of like, it's not like we are, like the patients of bariatric surgery are being the victim, because this is what we expect from everyone. So there shouldn't be any relentless, just, out of control drinking. But now knowing that your body is going to go through a big change, that's what I hear from you is, like I just saw that patient that you sent me with the BMI graph. That patient lost 120, 130 pounds. So
yeah.
when you lose, so let's just highlight that's not a bad thing. So we want people to lose that much weight, right?
Yeah.
But that's a new person, new body, so that everything is going to be different, and how our body is reacting to certain things, because that happens in a very short amount of time. So it's not happening in 6 years; it's happening in 6, 7 months. So therefore, we are going to see. We are not going to know how we are going to react to those. And the best thing is being knowledgeable, being aware of what this will be. Like tonight, we have a Christmas holiday party. So, and they asked me whether or not I want lunch, and I'm going to probably have a late lunch just because I don't want to eat too much at the party, right? So if I have a couple glasses of alcohol, I want to prep my body so that I don't get drunk or out of control with alcohol. So this is all about how we are prepping our lives, how we are prepping our own body.
Yeah. So these are essentially it, right? To understanding that your body is different after bariatric surgery, right? And then what alcohol does. So how should people go about it? What kind of guidance would I give them as a bariatric surgeon? One of the things I tell people, Kemal, is that if you've had bariatric surgery, avoid alcohol for at least 6 months. It's just keep it out, right? Don't even think about it, right? For 6 months, right? And then afterwards, if you were to introduce it, then there are some important rules. We talked about the fact of quantity, right? The amount of alcohol that could make you intoxicated before bariatric surgery now is way, way too much, really. A much smaller amount, maybe half of that, maybe a quarter of that could be intoxicating now, right? So that's important. But the other things to consider are, when you are considering an alcoholic drink, of course, you want to make sure you don't consider something that, is carbonated. So beer and things like that are out, right? Because we, as a guideline, we tell people not to have anything carbonated, right? The next thing is, if you're going to have mixed drinks, make sure you don't get something that has too much calories, too much sweets in it, right? Because those by themselves are going to increase much more the effect of the excess calorie when you're about to drink. And then, as we were mentioning earlier on, you have to be measured. It's very important because, sometimes if people get distracted and drink too much and they get intoxicated too quickly, then their sense of judgment also goes away. It's almost like a vicious cycle, right? You were very careful, right? But if it hits you too quickly, then that care is not there anymore, and you may start, doing things that may be very difficult. So that I tell people also that, if you thought that just having a glass of wine was okay to go driving, before bariatric surgery, now it's a no. Do not drink and drive after bariatric surgery again, because the effect is a lot stronger, much more impactful, but also the effect can stay there for longer. So it's really very, very dangerous from that point of view. And then, of course, I talked about the fact of, the weight regain. For patients who have had gastric bypass, they could have something called dumping syndrome, which is very, very unpleasant reaction, particularly if that alcoholic drink had too much sweet. But there are other things, Kamal. The alcohol itself can be corrosive. It can actually damage the lining of the stomach. It can lead to gastritis. It can lead to ulcer formation, and ulcer formation, particularly after gastric bypass, is something that can happen, and it can be very, very serious problem because ulcers can burst, ulcers can bleed, right? But then with excess alcohol, there is a much, much lower threshold for getting things like liver damage as well, right? So really, all these are important points. So people who had gastric bypass drinking excessive alcohol can end up with liver failure a lot more quickly than people who didn't have gastric bypass. So your ability to protect your liver is much less in that situation. And that would obviously be very, very devastating. And there is another area that is very important, Kamal. How about becoming alcoholic after, bariatric surgery? How about falling into a trap of alcoholism? Well, as it happens, it can happen, right? It can happen. So anybody who felt they may be vulnerable to this, before a bariatric surgery, their best point might be to just stay away completely, particularly if they were using food as a way of coping with stress. Now that they cannot do that because their stomach is too small, they can easily fall into a trap of utilizing alcohol, substituting alcohol to food, and that obviously would be devastating as well, because alcoholism by itself is a devastating condition for anyone. Now, granted, it doesn't. This is not something that can happen only to somebody who was prone to alcoholism. Anybody can become alcoholic after bariatric surgery much more quickly, obviously, because, as I said, that the amount of alcohol that are needed for somebody to become intoxicated are much smaller. But this is an area which is very, very important for people to understand. So if there is any inclination for anybody to really become vulnerable to alcoholism, their best option, best policy might be to abstain from alcohol completely. So essentially, the message I want us to give, Kamal, is that there are real dangers when you start entertaining the utilization of alcohol after bariatric surgery. It doesn't mean you cannot, but your guardrail must be up really high, so that you protect yourself, your health, and also don't fall into a situation where you start regaining weight because you're utilizing, empty calories that come with alcohol.
So what I hear is don't sabotage your process.
Absolutely.
That's it.
Absolutely.
Right?
Yeah.
Now, let's talk about smoking. Again, from the pre and post-surgical, what's our approach on smoking?
So a very, very important topic also. I mean, one thing that you said earlier on that is really, if you think about it, is actually incredible, is that you say we don't see as many smokers, right? Well, because our society has actually moved, and I think this is probably one of the biggest triumphs really of population health, is really educating people and educating our society that smoking is really a devastating condition. So we don't see as much, but obviously we still see it. Now, for smoking, it's important to look at it definitely as pre and post bariatric surgery. Pre-bariatric surgery, as you know, the policy in our program is that you cannot have bariatric surgery if you are a persistent smoker, right? Why is that? Well, because smoking does expose you to some real potential complications that can occur at the time of surgery. And our goal is obviously the safe performance of bariatric surgery. We want people to go through bariatric surgery safely. So anything that we can do to achieve this, we will do. And one of the things we like to do is to actually make sure people are not smokers, because if you're a smoker, you can have complications related to anesthesia, whether it's pneumonia, whether it's blood clots, which are, very, very substantial problems, essentially. So we ask people at the first consultation, if they have a history of smoking, we tell them, stop. When should we stop? Well, preferably 2 months before, right, bariatric surgery. And we prepare them for quite some time because we have an extensive program. And as you know, one of the things that our bariatric coordinators check is if there is a history of smoking, they do go through the smoking cessation program, which is something that is triggered to help people stop smoking. And by and large, people actually comply with this. I'm very happy to say.
Now, can you explain, because the way that you explain things makes it easier for people to understand. So what happens when you smoke? How our body is reacting from the first inhale to the next exhale? What happens throughout that process? Maybe in simple words, if you can actually explain that.
Well, come on. We breathe continuously, right? Breathing does not stop, right? We have to, if we stop breathing for as little as a minute, then, we're in serious danger, right? So what do we breathe? We breathe air that has oxygen, right? And we bring out carbon dioxide. This is a way for our body really to stay alive. Our lungs are built, they are amazing, amazing structures that are built to really to absorb the oxygen within the air that we inhale and then discard carbon dioxide, which is the waste that comes out with the processes within our body. When people smoke, what are they doing? They are really inhaling a lot of toxic substances, right? Very highly concentrated, that will be clogging their airways, that will be impacting their lungs, right? So their lungs lose their capacity, their reserve to help them breathe, really, right? Now, in an ordinary situation, when they are going throughout their life, this may be expressed just as a cough or something like that, right? But what about when they are vulnerable to problems? Like, for instance, they are undergoing anesthesia, when somebody else has to take over their lung function, the anesthesiologist, right? Well, as the anesthesiologist is trying to wake a person up by taking the breathing tube, the anesthesiologist is relying on a very healthy lung to be coming up and take oxygen and replace that tube and for the person to take enough. But if that lung is already disadvantaged because of all these toxic things that the person was putting into their lung, that lung is not going to have the capacity to come up very quickly, right? So you have a setting in which the person doesn't breathe properly, they don't expand their lung properly, and they develop things like atelectasis, which is a lot of their lungs become collapsed. They are not absorbing oxygen, right? So their oxygenation can go down. And on top of that, because of their obesity, they will have decreased lung capacity, Kemal. So adding all these really is asking for trouble, right? When you are going through anesthesia where a machine is taking over your breathing function, you want your lungs to be top-notch so they can recover very quickly when you are becoming conscious and they are taking over the breathing, from the machine itself. So that by itself can create problems. On top of that, smoking can lead to increased levels of blood clotting. And blood clotting is something that can happen just because of anesthesia, just because of surgery. And we do many things to prevent it, including giving people blood thinning medication, putting special boots around their legs, and we've done a fantastic job in decreasing this risk. But that can be sabotaged if the person is smoking. So we want to take people through bariatric surgery, which traditionally has been thought as a very, very dangerous surgery. And we brought that safety level to the levels of gallbladder surgery, hysterectomy, joint replacement surgery, right? That is it. In fact, there are statistics, Kemal, showing that it's more likely for a person to die after gallbladder surgery than gastric sleeve surgery. I mean, data is showing that. So that level of safety we have achieved because of this type of preparation, right? So one of the things we ask people is we say, if you're a smoker, you're asking for trouble. We politely ask you to stop smoking, and we will give you and provide you all the help you need for you to be able to stop. And guess what? Not only they're going to make their bariatric surgery safer by stopping smoking, but they are going to prolong their life expectancy by years just because of that issue of stopping smoking. So in my view, Kemal, there is nothing more satisfying than seeing a patient who used to be a smoker, used to be morbidly obese. They come and see you 6 months, a year later, as a person who's not morbidly obese anymore and is not smoking anymore. What a way to change totally your trajectory of life, right? How profound a change is it to the health of a person, non-smoker, and then a healthy person as well, because they've lost so much weight. So it is important before bariatric surgery that people really listen to us, that stopping smoking is critically important.
So, I mean, if you think about it, Dr. Irgau, so a person who's going through this process already made a major decision. So that major decision has its own responsibility. That is, you are not there to negotiate from your old habits what you should be keeping, because you already got to a point where you have to make a major decision to change where you are. And this is the most efficient way, is the bariatric surgery for the morbid obesity. So that means the best would be not to come to the table with the mind of negotiation and then see what I can actually keep. But like we don't, keep those things, even if you are not going through the surgery. That's the thing that people really need to understand. So this is not about just the surgery itself. So as you said, the smoking makes so much, way too much impact on our body, the way just like every second, every minute, what we are going through is being affected by this, and the same as the alcohol. And come to the table with zero agenda from the patient standpoint. So that I think that would make it better. Now, if the problem is there, so I can probably tell you with confidence, I don't believe there's any other program in the United States or in the world, in our setting, who does this better than us in terms of screening and working with the patients. So this is probably one of the world's best bariatric program. Now, I know this because I do this every day with our team. Every day there's a case conference. Every patient is discussed at least once a week. So many different checkpoints. And when we see, like something that you mentioned, when we see people who were smoking and then they actually quit before the surgery and they keep that. So those are the extra benefits that actually comes with the weight loss. It's not just about losing weight, but it's healthy, being healthier and better yourself. So, and this is why it's important for us to kind of have the clear mind. So you are going to have a new life, and that comes with its own, benefits and responsibilities. And I know our patients, I would say 97% of the time, they do a great job following our instructions. But I think this episode is, again, is another resource for people to maybe sometime hear, because in the office visits, we may not have so much time to really discuss, like we may not be able to spend 20 minutes just on smoking and alcohol. But with this video, I'm hoping that people can find this additional resource to better understand why they should actually change their mind.
Yes, the one twist that comes with obesity and smoking, Kemal, is that it's not unusual for people to argue that they are smoking because if they stop smoking, they will continue to gain weight, and that's the reason that they're smoking. And, there may be some truth to that, but it is very important for us to really make sure they understand that the benefits of stopping smoking far, far outweigh any benefits that they may see by, being able to control their weight with the smoking. So that's very important from a health point of view. But also when they come to us, they're coming to us because they want us to help them lose this massive amount of weight, right? And we have means to do that. We have the most efficient, treatments available to do that. So we don't need the help of the cigarettes for that. The cigarettes don't belong there. So even if they end up gaining a few pounds because they've stopped smoking, we will understand that, and that we will take into account. There's nobody who's going to be judgmental and penalizing people because they've gained weight because they've stopped smoking. Of course, we're hoping that during the preparation, with the teachings that they get from a nutrition point of view, with a new way of living that they will acquire, they will minimize that weight gain. But even if they were to gain weight as a consequence of stopping smoking, so be it. The benefits of stopping smoking are far more important from our point of view. And this is a point I make to the patients all the time.
Absolutely, absolutely. Dr. Ergau, thank you so much. I know we have done this topic in different times, and we have them in specific playlists now. So if we didn't cover certain things in this one, I'm sure we did it in the last 5, 6 related to smoking and alcohol.
Absolutely.
Because we don't have a set, script for these events.
Yeah.
We are able to cover it in a different way, and hopefully our patients are finding this useful, and they can take advantage of these videos, resources out there. And thank you for joining us today. And I'm sure I'll see you later tonight.
Absolutely. Thank you. Have a nice weekend, everybody.
Moderate alcohol, right? Have a great week.
Absolutely.
Thank you so much. Bye-bye.